Okay.
I'm going to introduce Dr. Mironov. His title for the webinar this evening is New Horizons for the Erbium YAG Dental Laser, Realizing the LightWalker's Capabilities, a scientific comparison of the LightWalker's QSP and MSP pulse capabilities compared with the high-speed drill. Dr. Evgeny Mironov is the owner of Dental Studio Mironovi in Sofia, Bulgaria. He practices general, endodontic, implant, laser, and aesthetic dentistry and has completed several advanced courses in all of these areas. Dr. Mironov is currently working on his Master of Science in Lasers and Dentistry degree from the Aachen Dental Laser Center in Germany. And the AALZ, the Aachen Dental Laser Center, works in cooperation with the Clinic for Dental Conservation, Periodontology, Preventive Dentistry at the University of Excellence in Aachen. And it is known for its research in laser-assisted dentistry and is one of the, if not the premier advanced master's program in the world in laser dentistry. We really appreciate Dr. Mironov taking his time out of his busy schedule and also staying up very late for us because I believe it's about 2:30 or 3 o'clock in the morning in Bulgaria. So Dr. Mironov, without further ado, I'll turn the time over to you, and we appreciate your sharing your research that you've been doing with us this evening.
Thank you, Mr. Bateman. Welcome, everyone. I want to show you one study which I'm doing for my master thesis in Aachen, and I decided to promote this earlier because I got some very interesting and nice results with in vitro tests on a bovine teeth, and I was very glad of these results, and I wanted to show to the audience. I had a chance to meet Mr. Jeff Jones in Slovenia, and we organized this webinar for you. So I will begin with a short explanation of the technology I promote and I use every day in my practice. This is one feature of the LightWalker machine, LightWalker AT. It's a QSP mode, and in brief, it's a quantum square pulse, or I tell it quick and silent preparation, because it's clinically notable that you are faster than other modes like MSP or normal super short pulse, and you're maybe 30% quieter. We didn't check the decibels till now, but I plan to do this. And you can hear the machine is working a little bit quieter, and the patient feels more comfortable because you know the level of noise usually afraids and scares the patients, and they are so afraid of high-speed drill because of the sound. So we have a really advantage to use the lasers, but sometimes, especially in larger energies, when you are over 300 millijoules and you're a little bit far from the working field, from the tissue, there is a noise which is like a hammer knocking. So with the QSP mode, this sound is reduced, and I will tell you in brief about the physical basics of this mode. First, when we talk about the excavation tissue with the laser, we have to know that we are working on a basis of ablation phenomena. Ablation is a thermal vaporization of the water on the border with the dental tissues. So it depends on the absorption in water, and the spray which is supported from the machine, it's water and air spray, It's not only the cooling effect, but this is a mediator, and you need this spray, this water, to have a successful ablation. When you have enough energy or average power also, you are in a cold ablation mode, cold regime, and all the energy is absorbed in the cloud of water and air and enamel parts. So you have just removal of the tissue without thermal effects in deep and without side effect of a pulp damage or hypersensitivity or something else. So the key for successful laser treatment is to avoid these thermal effects. So if you lower the energy, this ablation will turn in warm and hot, or either you don't have you can have no ablation. When you use a very long pulse with a low peak power, you have coagulation, but this is very important for soft tissue, so this is not a problem. This is again a feature of the machine. But for hard dental tissues, we need a cold ablation modes. So to be sure in this cold ablation, we have to remove the side effects, the unwanted effects of the absorption in the debris cloud. Because you know, when you shut the, you got first shut on the enamel, the debris cloud rises up, and the energy of the next pulse is absorbed in this debris cloud. So energy transmitted to the tissues is a little bit lower than we think we have. So this changes the ablation regime, and you go into warm ablation. And if this is deep, you can get some thermal effects. So to avoid these thermal effects and to have a clean cuts and the nice borders, sharp borders of preparation, the QSP mode is invited 1 year ago. It is based on the chopping the signal of the long pulse into 5 shorter pulses with 60 microseconds pulse duration, thus allowing us to have high peak powers with very high pulse energies. And we have to up to 120 hertz rates possible for erbium YAG. Why is this possible? Because we calculate the hertz rate, the repetition rate on your machine, and you calculate it times 5, because in every pulse you have 5 pulses, 5 shorter pulses. So the pulselet spacing between these short pulses is very short, but it's enough for debris cloud to fade away. So you got every pulse in the clear conditions, and you deliver the clear energy as much as you need to the tissues. So it makes you sure you are in cold ablation regime, and you deliver the energy what you need to the tissue. This high repetition rate up to 100 Hertz is good working in soft tissue management, and I show you later some examples of gingivectomy that you will see that because of the high Hertz rate in soft tissue you got some warming effect and a coagulation effect added to very clear cut. Used delivered this clear cut because of using short pulses, because you know if the pulse is longer there is appears a coagulation and the cut is a little bit wider than you want it to be. So we go into the next slide about this in vitro study on the bovine teeth. I choose 3 modes of QSP modality for this assay because of my clinic experience and